Welcome to Indiana News Desk. I'm Joe Wren. More cases of human trafficking are being identified across the country each year, including in Indiana. Hospitals and medical professionals can play a large role in tackling the issue. Lindsay Wright is here with more.
That's right, Joe. They can, but it's not an easy task. Hospitals face a number of challenges when it comes to confronting issues with human trafficking. Doctors, nurses, they're strapped for time. That's why experts are implementing what they say is a more comprehensive way to get those professionals the training they need. Robin Uberta is a forensic nurse examiner for Community Health Network in Indianapolis. She sees patients who come into the emergency department and may have injuries because of abuse, neglect, or violence. Those patients come here to the Center of Hope.
Nurses are the most trusted profession, so I'm always surprised at how much patients open up to me so quickly.
Uberta says sometimes patients just want support. Other times, they might want a sexual assault kit done or their injuries photographed.
This is to look for body secretions. So I don't know if you can see.
I see
can
that.
you see the illumination?
Yeah.
So right there's the.
Yeah, there's the spot.
She sees all types of patients, including those who are victims of human trafficking.
We have a really unique role in healthcare that at some point these trafficked victims are going to need some type of medical treatment from a physician, whether it's to get antibiotics or to get on birth control or get pain medications or need a suture or something like that.
Uberta says simply recognizing a patient is being trafficked is difficult. They don't always know they're being trafficked, and their trafficker could be a significant other or even family member. But identifying cases is critical. According to the nonprofit anti-trafficking group Polaris Project, hospitals are the third point of access for those experiencing trafficking. So getting healthcare workers the training they need is key.
And it's not just physicians and nurses, it's security, it's the intake people, the triage people. Every point in that healthcare system, someone would be able to recognize if they're trained properly.
There are barriers in making that happen, though. Kate Kimmer works with the Indiana Coalition to End Sexual Assault. She says there's a lot that goes into training healthcare workers, not just teaching them to notice the red flags.
Okay, great, like you can tick a box, I identified somebody, but like seriously, then what? Who's your law enforcement partner? Who's your service providers you're referring to? How can you get that person help if they want it, right? I mean, that's a kind of a bigger part of the conversation than just identifying.
And the next challenge is time. Healthcare providers are busy, so locking them into a comprehensive training seminar isn't easy. Members of an anti-trafficking task force are launching a 90-minute webinar training video that hospitals can use to help their employees get the information they need and at a time that works for them.
And that would be kind of that general call out that people could watch anytime and check their knowledge, make sure they know their knowledge, and would have access immediately to certain referral pathways and resources within the state of Indiana.
When we talk about domestic violence,
the video includes information about trafficking laws and red flags, and it also breaks down the stereotypical illustration of human trafficking.
In general, we are not going to see human trafficking victims come into our healthcare settings in shackles.
Officials say the webinar will ease the strain on current trainers, too.
Our IPATH roles are very dear to us, but it's a volunteer capacity, and so we all have full-time jobs. So we can't, that's a barrier that we faced, is having enough trainers to go out and do the training.
The webinar can be used in facilities statewide. Uberta says it's a step in the right direction. She says after some community staff members received training, they identified more than a dozen victims in 2017.
We need to talk about how it impacts our community and how these people are coming through our hospitals and how we can make a huge difference with protecting them. They're no different than any other type of victim of violence that we dedicate our time to.
Interesting story, Lindsay. So now the doctors and so forth go through and do the webinar, but then what happens?
Then they can request more training. So someone with the IPATH task force would go in and work with certain people from the hospitals. Then those folks would work with other people in the hospital. They call it train the trainer. And the goal is for hospitals to really own it, to make it their own thing. They think it'll be a more comprehensive, sustainable way for hospitals to train folks and to kind of get on the same page.
What are some of the other barriers that they face besides just the training part of this?
Well, Robin Uberta says she thinks one of the biggest barriers is getting executive leadership fully on board with this, recognizing that human trafficking is an issue. But she did say community health, for example, is working to require staff participate in training efforts. Another challenge is the lack of data. This is a hard thing to track. So now IPATH will ask hospitals with this new system of training to collect data on identified cases. They want to know what's working, what's not working.
And we're just talking about healthcare right now. We know there are a lot more. Is there something that the state is doing to help out?
Yeah, so one idea that the legislature is kind of tossing around is whether a single state agency for adult victims of trafficking is needed. So a single point of access. And I attended a study committee a few weeks ago that touched on that topic. It would be kind of like the Department of Child Services for kids, but adults. And you know, some people said it's all over the place. They don't really know where to go for resources. Maybe a single point would help. But Kate Kimmer says this is just a no-go. She says organizations like IPATH, they're already doing these things. They've created a network of tons of organizations across the state that are working on efforts against human trafficking. So she straight up said to lawmakers, don't reinvent the wheel. Maybe give us funding so we can do the job better.
All right, Lindsay, thank you very much.